Good morning, everyone. Today is Thursday, August 30th. Thank you so much for joining in to our weekly webinars. We do have a lot to talk about today, so as always, I appreciate you joining in. If you are new to the webinar, there are two ways that you can ask questions. You can raise your electronic hand in the control panel to the right of your screen, or you can type in your questions in the question box, and I'll answer those at the end of the webinar. For those of you that are new, my name's Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. A lot of responsibilities with this god-awful law that we have to experience, and of course the infamous fourth quarter, which has begun. So again, I appreciate you joining in. Let's get right into the agenda. So we've talked a lot about, we've talked a lot about my technology challenges. We've talked a lot about those, and you can see why I say that. But back to the agenda, we've talked a lot about the short-term medical, changing to the short-term limited duration medical insurance. It can be written instead of an 89-day max. It can be written for 364 days. That is, those plans are available for sale after October 2nd. And there is a PID flyer that is not attached. I will try to find that and get that in the next email. I apologize. Basically, it's on the Department of Insurance website. It has all the disclaimers, but it gives a side-by-side comparison and not a friendly sort of light between an ACA policy marketplace or off marketplace in comparison to the short-term limited duration medical insurance. You know, we know what these are. They don't cover pre-existing. They do run the risk of, at the end of the 364-day policy, not qualifying again because of something that happened within the 364 days. But I do think that it can be a solution for a lot of folks that do have decent health history, that are looking to save money and know exactly what they're getting into. No bells and whistles, no essential health benefits. You know, and as long as you're selling it with that in mind, I think that, you know, it's a real opportunity. I did hear from Phil Mishler, who is our National General Representative, and commissions are holding. Rates are to be released within the next couple of weeks. But the good news is Phil will be joining us on Thursday, September 13th, and I'm going to give him about 5 to 10 minutes to talk a lot about this short-term limited duration medical insurance. And again, it's commissionable. Commissions are very attractive, and I do think for those of you that still work in the individual market or in the Medicare markets, or just, you know, have those clients that you still accommodate in the individual market, that it's a good option for some. So keep it in mind. This is a big one. Association health plans. You know, the last several weeks I said, if you're an association or working with an association, reach out to me. I still say that. However, this just in, Commissioner Altman wrote a letter to the Department of Labor and CMS HHS on August 2nd, and that letter is attached. And then there was a press release late on Friday basically indicating that association health plans for Pennsylvania are going to be allowed. However, when you read the stipulations, it kind of blows everything up. They already put out rules that a sole proprietor is not going to be considered within these association health plans. So they did go further by saying that sole props, their rates are going to be individual rates. For groups 2 to 50, their rates are going to be ACA rates, and for the 51 plus, it's going to be, you know, according to ACA rules, large group rates. And what that means is that they also have to comply with the control group rules. So there's no real common ownership. You know, so essentially there's no banding of these association members and coming up with a family of rates. The rates are going to be the rates. So details are still being worked out, obviously. I've talked to Highmark. I have messages into Capital, and the other carriers that we're working with these associations to see kind of what their interpretation is and what the next step forward is. But at this point, seems to be belly up in a lot of ways. So moving on, 2019 FFM certification, that is available now. AHIP and MLMS are the two vendors. The AHIP does have a cost, but there are CE credits available. If you are in the Medicare market and have done your AHIP testing for your Medicare certification, you still do have to pay for the FFM certification through AHIP. If you choose to use that, but the MLMS is absolutely free. If you're a returning agent and broker, it's a very, very short process. It's about 3 modules, and I think 2 securities and then 1 test. So it's pretty easy. I did find out that the Highmark ethics certification that we've had to do through you know, those vendors in the past years, that is no longer required. So they do still require that if you are selling on or off marketplace that you do your 2019 FFM certification, but that additional step is not required. They are working on their training modules now and should have that out. That also is not mandatory, but it would have everything that you would need to know about the 2019 plans. And they anticipate having commission information released the end of September so that we as brokers and brokerages can come up with some sort of plan. So that's kind of the time frame with Highmark. Capital, not a lot other than their filed rates on the individual side are much lower. And they still have their grandmothered individual plans, which they'll retain those as well. So that's what I can tell you about the central area for the individual market. Pardon me. There was an article that, in light of Senator McCain's passing, that you know, a new senator could be elected or appointed by the governor, and you know, could possibly repeal the ACA since Senator McCain was a dissenting vote. But that would not be till 2019, and I don't know that any of us can stomach any of these repeals again, but it is something, and we'll certainly keep watching for that. So into the agenda, Aetna added 2 new AFA plans in time for the 12/1 effective dates. Details are in the newsletter, but they have a no deductible plan. They have a $25.75 and a $40.75 PCP specialist copay option, and an in-network lab covered in full or $15 copay. So it does look like they have some attractive plans in their AFA. Remember, they are level funded and they go down to 5. They're very competitive right now, you know, but just like anything, that's for now. So hopefully you'll take a look at those as well. Their UPMC signed an in-network access deal with Commonwealth Health. It's in the Wilkes-Barre area, and it includes 6 hospitals. So you can see UPMC is traveling across the state. Of course, we have the UPMC Pinnacles here in Dauphin County. That will have some rates and some programs for 1/1 as well. There were more bonuses added. See the attached bonus flyer. I did include those updates. CBC came out with bonuses for retention and for new business, and then Highmark came out with, for Central and West, a 51 plus bonus. So take a look at those. There are, I don't know any carrier that's not offering a bonus for 4th quarter, so make sure that you're aware of those, because that's extra revenue in your pocket for all of your hard work. September 5th, next week in Hershey, the Medicare Connections Conference. I hope to see you there. I'll be there for an hour or so, hopefully getting to see you and catch up. So if you're registered, I look forward to seeing you next week. Also, September 13th from 7:30 to 5, CPHU, Central Pennsylvania Association of Health Underwriters, is having their first Medicare Summit, and that's at the Holiday Inn East. That is $49 if you register today. After today, it's $59. So I'm not sure of the agenda specifically, but it did look like they had some nice speakers set up. I would encourage you, if you're in the Medicare market, to attend both, because I think each will have, you know, different focuses in their program. So that brings us up to the open discussion, but as always, I thank you for joining in. Just as you're formulating your questions, next webinar is September 6th. We will have Ryan Weirling and John Fissner from Able Pay. They're going to be doing about 5 to 10 minutes on the Able Pay program, which is absolutely free to employers and employees. It's, you know, I don't want to minimize it, but it really is a way to pay for those out-of-pocket expenses in the best way that consumers can for their families and their budgetary needs. And the hospitals, because of Able Pay, are able to offer a discount. So it's a win-win-win for everyone, the hospitals, the employers, the employees, and agents as well, because it is a commissionable product. So hopefully you'll join in next week and learn about that. And then, as I mentioned, Phil Mishler from National General will be doing about 5 to 10 minutes on the short-term limited duration medical insurance for on September 13th. So hopefully you can join in there. That brings us up to our questions. Let's see what we have here. We only have a couple. Dave says, can a person sign up for another 364-day period and not have any lapse in coverage? Yeah, they don't need to have a lapse in coverage, but it is a brand new policy, and you know, new pre-existing, new qualifications do apply. That's the real challenge with these programs, that you have to kind of throw the dice and hope that your health history maintains that, you know, through the 364 days. I can tell you it's a much better and more attractive deal than worrying about 89-day increments and rewriting these plans. So Nate says, I was late. Is there a PID about short-term medical? There is not. It was about the association health plans, Nate. And I don't believe you're working with associations or that I'm aware of, but we can talk offline. Essentially, the rates are going to blow up. Will you be putting on screen attachments? I can, sure. Able Pay is coming up. Ooh. I'll tell you what, Pam, I'll email them to you because I have 4 today. So I will email them and get those over to you so that you can look at them. Anybody else that wants to have them emailed, all you have to do is just shoot me an email, debw@urlinsgroup.com, and I'll send those over to you if you aren't able to download them from your webinar control panel. So that's really it. That is all of our questions, and that ends today's webinar. As always, I thank you so much for joining in. Hopefully that you'll get out and enjoy this Labor Day holiday weekend. For all of us that labor, I hope the most that you have to do is lift a heavy cold beer, and that would be your labor for the weekend. So as always, thanks so much for joining in. I wish you a great balance of the week and a wonderful holiday weekend. Bye-bye.